Bismillahirrahmanirrahim. I'm Dr. Javed Iqbal Khokar, Professor of Forensic Medicine and Toxicology. As I'm discussing the personal identity, and this is the 12th lecture of this series, and today the learning objective and the uh, contents of the talk will be the parameters of the age determination. And in this lecture, I'll be discussing the age estimation in advancing age. And this is done from the skull sutures and from the lipping of the vertebrae and the fusion of the hyoid bone, the greater cornu, with the body. And this is the age estimation from later ages. Regarding the skull sutures, in later ages, the age is estimated from the closure of the sutures of the skull. So the fusion of the skull suture is an important criteria after the age of, especially after the age of 35. And the absence of closure of any suture of the skull indicates that age does not exceed 30 years. So if there is no fusion at all seen in any of the sutures of the skull, the age of the individual will be less than 30 years. And this is a radiograph, and you can see the sagittal suture and the coronal suture. They are both are open, they are not fused, even partial fusion is not visible. So age is less than 30 years. And this is the different age parameter of different skull sutures, indicating that how they fuse with advancing age. And this is a pictorial diagram, but I will be discussing in the tabular form. It will be much easier to understand. So the union of sutures regarding the sagittal suture, it is from 30 to 35 years. Then coronal suture fuses from 35 years to 40 years. And the lambdoid from 45 to 50th year. The palate suture, it fuses from 45, also from the 45 to 50 years. Then parieto-mastoid suture, it fuses in 55 to 60 years. The squamous suture also in 55 to 60 years. And sphenoparietal in the age of 70. There is an exception to this rule, this closure of the sutures, that is for the basilar suture. And in the basilar suture we know that there are two parts, the basi-occiput and the basi-sphenoid. So the fusion between the basi-occiput and basi-sphenoid is completed by the age of 18 to 22 years. So it is earlier than the other sutures. Generally, the fusion of the suture, it commences endocranially and extends to ectocranially. That means when we physically see from the inside the calvaria, the fusion is from inside towards outwards, endocranially towards ectocranially. So fusion first commences endocranially and then it extends to ectocranially. Then the other criteria is the lipping of the vertebra. This lipping can be seen after the age of 40. The osteophytes, they grow from the anterior and the lateral margin of the intervertebral discs, and you can see the hanging of the lips from the margins. And this is basically the growth of the osteophytes from the margin of the vertebral disc, and this is called as lipping, and it is seen after the age of 40. And at this stage also the discs undergo some atrophic changes, and they are quite marked in the age of 40 and 45. So this is a radiograph. In this, the lipping is not as marked. You can see a little prominence but not as marked. But this X-ray, you can see between the cervical 4 and 5 and 5 and 6 and 6 and 7, the lips have been formed and they are quite distinct. This is lipping of the vertebra, and this starts at the age of 40 and well marked up to the age of 45. Then the other criteria in the advancing age or later age is hyoid bone. The greater cornu of the hyoid bone unites with its body at the age of 40 to 60. As we know that hyoid bone has three parts: the body, greater cornu, and the lesser cornu. The fusion of the greater horn or greater cornu with body is after the age of 40 and up to 60. And you can see this is a radiograph of hyoid bone with its soft tissues. The body is quite distinct and the greater horn or cornu has not fused with the body. The joints are open. And this is a completely ossified body, lesser horn and the greater horn. So thank you very much. So these were the criteria from the sagittal suture, from the hyoid bone, and from the lipping of the vertebrae when we estimate the age in the later years after 35. Take care, Allah Hafiz. We'll continue the topic of personal identity.